my name's Laura. I'm going to be your nurse today.
Okay.
I'm going to give you some privacy and wash my hands.
Okay.
Can you tell me your name and date of birth?
Sure, it's Rebecca Lindsay, and my date of birth is January 13th, 1971.
All right, Miss Lindsay. What brings you in here today?
Well, my right wrist has really been aching. I'm worried that I have carpal tunnel.
Okay. Can you describe your pain to me?
Well, it's just aching, and I would say it's really worse when I'm on the computer.
Okay. On a scale of 1 to 10, how bad is the pain?
When it's aggravated, I'd say about a 7.
Okay. And normally, what is it?
Well, right now it's kind of a 3. It doesn't hurts when I move it, I guess.
Mm-hmm. Do you have any other signs or symptoms of your pain? Nausea, vomiting, headache?
No, it's really just in the wrist.
Any tingling in your hand?
A little bit in the fingers.
Okay. How do you treat your pain?
Well, if I put some ice on it, that seems to help.
Okay. Do you do medication?
Sometimes I take ibuprofen.
Okay.
That helps too.
Mm-hmm. How long did you say that this has been happening?
About 2 months.
All right, so it's still fairly new.
Yeah.
All right. So the doctor's going to be in a minute. I'm going to have him talk about your carpal tunnel and possible treatments for that. But in the meantime, I'm going to do a head-to-toe assessment on you.
Okay.
So I'm going to start off with your head. Do you have any headaches?
No.
Dizziness, lightheadedness?
Not at all.
Okay. Have you had any head injuries?
No.
Any loss of consciousness?
No.
Okay. What about your eyes? Have you do you use prescription lenses?
I have reading glasses, but that's it.
Okay. When was the last time you got your vision checked?
A month ago.
Okay. And no change in vision since then. Do you have any allergies?
Nope.
Any running eyes, itchiness, redness?
Nope.
Okay. I'm going to shine a light in your eyes real quick.
Okay.
So go ahead and look behind me. Okay. And if you could follow my pen.
Okay.
All right, very good. What about your hearing? Have you had any changes in hearing?
Not at all.
Any discharge from your ears?
Nope.
Pain, tenderness?
Nope.
Ringing in your ears?
Mm-mm.
Okay. What about your nose? Have you had any changes in your sense of smell?
Nope.
Any running nose? Frequent sinus infections or
No.
colds?
Not at all.
Okay, can you cover one nostril for me and breathe in? And then cover the other one? All right, very good. Have you had any changes in your sense of taste?
Nope.
Any sore throats? Changes in your voice?
Nope.
Any toothaches?
Nope.
Sores in your mouth?
Mm-mm.
Okay, could you open up for me? Stick your tongue out and go ah. All right, can you lift your tongue? And then to the side, and the other side. Very good. Could you push your tongue against your cheek? Good job. So I'm gonna do some faces at you right now. Could you do them back to me? Raise your eyebrows and squint your eyes. Puff your cheeks out. Smile and clench your teeth. Good job. Everything looks good. So have you had any neck pain recently?
Nope.
Have you noticed any lumps or anything in your neck?
Mm-mm.
Tenderness?
No.
All right. So could you look at the floor for me? Then look up at the ceiling. Tilt your neck to your right shoulder and to your left. Oops. Over your shoulder. And look over the other shoulder. Okay. Any pain with any of that?
Nope.
Okay. How about your joints? Do you have any joint stiffness, joint aches, any muscle pain?
No.
Tenderness?
Nope.
Okay. Could you raise your arms up for me? And back behind your back. And can you raise your thumb up? All right. So I'm going to test your strength in your wrists and arms. If it hurts your wrist, just let me know and we can stop and do something else.
Okay.
Okay, so if you could push against my hands. Oh. All right. And then down. And squeeze my fingers. Good job. All right, I'm going to check your pulses. Okay, and then I'm going to check your capillaries. Do you notice any tingling in your hands other than in your wrist?
No, not at all.
Any in your legs?
Mm-mm.
Any excess swelling in your arms or legs?
No.
Okay. So I'm going to go ahead and I'm going to feel for the pulse in your neck.
Okay.
And after I do that, I'm going to go ahead and take a listen, okay?
Okay.
All right, when you feel my stethoscope, go ahead and take a breath in, out, and hold it.
Okay.
Okay, and then I'm going to do the other side. Go ahead and take a breath. Take a deep breath in and hold it. Okay, Okay, sounds good. I'm gonna go ahead and listen to your heart now.
Okay.
Do you have any chest pain?
No.
Tightness?
No.
Shortness of breath?
No.
Any cough?
Mm-mm.
Okay. Do you smoke?
No.
Okay. So I'm gonna go ahead and listen.
Okay.
You can breathe normally for this.
Okay.
Alright, and I'm gonna go in between. And then I'm gonna go down under. And then I'm gonna switch it around and do this again, alright?
Okay.
Come into the side. And up top. Alright, it sounds good. Do you have any history of heart problems?
No.
Any like asthma or
Mm-mm.
anything? Any lung problems?
No.
Okay. I'm going to take a listen to your lungs. When you feel my stethoscope, take a deep breath in and out.
Okay.
Just let me know if at any point you feel dizzy and we can stop and take a break.
Okay.
Alright, I'm going to go down under again. Other side. And if you could lift your right arm up for me. And I'm going to come around the back. You feeling okay?
Yep.
Okay, everything sounds clear. So I'm going to talk about your abdomen now. If you want to go ahead and lay down.
Okay.
When was your last bowel movement?
This morning.
Is that normal for you?
Yeah.
Do you generally have about
One or two a day.
Okay. How many meals have you eaten in the last 24 hours?
2.
2? Okay. Do you have any nausea, vomiting, diarrhea?
No.
Okay. I'm going to go ahead and take a listen real quick. Okay, everything sounds good. I'm going to feel around. Do you have any pain or tenderness in your belly?
No, not at all.
Do you have any pain with urination?
No.
Do you have to get up at night to use the bathroom?
Only if I drink a lot before I go to bed.
Okay. So I'm going to feel around to let me know if there's any pain or tenderness. I can stop and we can take a break.
Okay.
And I'm going to go a little bit deeper.
Okay.
Okay, everything feels good. Do you have any issues with your lower joints, like your knees or your
No.
hips? Alright. If you could raise your knee to your chest. Alright, and the other one. And can you raise your legs straight up to the sky? And outwards? Good job. Okay. Do you have any swelling? You can go ahead and sit up. if you
Okay.
want. No? No swelling, pain, tingling?
Not at all.
Okay. Alright, I'm going to test the strength in your legs real quick. So if you could push up against my hands and push down, push in and out. Very good. Everything feels normal and equal. So if you could go ahead and stand up for me.
Okay.
Do you have any issues with your spine? Any pain or tenderness?
No.
Okay, if you could go ahead and face the wall over there and lift your arms up. I'm going to feel down your back real quick. And go ahead and bend down. Okay, everything feels good. And if you could go ahead and take a couple steps towards the wall. And then turn around and come back, heel to toe. Good job. Go ahead and you can take a seat. Great. Can you read the time on the wall behind me?
Sure. It's 1:30.
Okay, and can you read your instructions right here?
Yep.
Okay. Do you have any questions for me before I take off?
No, I don't.
Okay, the doctor will be in a minute to assess your carpal tunnel.
Okay.
Washing my hands. Give me some privacy.
Thank you.
All right, nice job.
10 minutes.